stop what you're doing right now. Because what I'm about to show you, most doctors will never tell you in a routine checkup. There is something on your skin, right now, that could be silently screaming that cancer is growing inside your body. Not in 5 years. Not maybe someday. Right now. And the terrifying part? Most people look at it every single day and have absolutely no idea what it means. I've spent over 2 decades as an oncologist. I have sat across from thousands of patients, and I can tell you, with complete certainty, that the ones who caught it early lived. The ones who ignored these signs, many of them didn't get that second chance. Today, I'm going to give you that chance. We're counting down the 5 hidden skin signs that your body uses to warn you about cancer growing deep inside. Some of these will shock you. Some will make you want to check your skin immediately. And number one is the one that even trained physicians miss most often. But before we get there, I need you to understand something critical. Your skin is not just a covering. It is the largest organ in your body. And like any organ, when something goes wrong on the inside, the skin starts to talk. Doctors call these signs paraneoplastic syndromes, skin changes triggered by cancer cells releasing chemicals that travel through your bloodstream and erupt on the surface of your body. Your skin is literally sending you an SOS. The question is, do you know how to read it? A 2021 study published in the Journal of the American Academy of Dermatology found that nearly 62% of internal cancers produce at least one visible skin change before any other symptom appears. 62%. That means your skin could warn you before the pain starts, before the weight loss begins, before it's too late. One of my patients, a 47-year-old teacher named Maria, came to me not because she felt sick. She felt completely fine. She came because her sister noticed a strange dark patch forming on the back of her neck. Maria almost didn't come in. She almost said, "It's probably nothing." It wasn't nothing. We caught her pancreatic cancer at stage 2. She had surgery. She is alive today, watching her daughter graduate college because she paid attention to one skin sign. This video could be your Maria moment, so stay with me. Because sign number 5 alone could save someone you love. Let's begin. Let's start with something most people completely dismiss. They see it, they Google it, they read harmless somewhere, and they move on. But here's what they don't know. Sign number 5, sudden unexplained itching with no rash. Not the kind of itch you get from dry skin or an allergic reaction. This is different. This is a deep crawling itch, underneath the skin. One that lotion won't fix. One that wakes you up at 3 in the morning. One that moves around your body with no explanation. Doctors call it pruritus, and when it appears without any visible skin condition, it is one of the earliest red flags for certain internal cancers. Here's the science. When cancer cells, particularly in lymphoma, leukemia, and liver cancer, begin multiplying, they trigger an abnormal immune response. Your body releases a flood of chemicals called cytokines. These cytokines travel through your bloodstream and attach to nerve receptors just beneath your skin. The result? An itch that feels like it's coming from inside your bones. A landmark study from The Lancet followed over 8,000 patients with chronic unexplained itching. The findings were staggering. Nearly 17% of them were diagnosed with an internal malignancy within 2 years. 17%. That's not a coincidence. That's your immune system raising an alarm. I had a patient, a 55-year-old engineer named David. For 6 months, he scratched his legs every night. His dermatologist gave him steroid cream. It didn't work. His wife finally convinced him to come see me. Within 3 weeks of testing, we found Hodgkin's lymphoma. Early stage. Completely treatable. David is in full remission today. What should you do? If you have itching that has lasted more than 2 to 3 weeks, has no visible rash, and does not respond to antihistamines or moisturizers, do not wait. Tell your doctor specifically that you want internal causes ruled out. Request blood work. Push for answers. Your itch may be trying to save your life. Now let's move to sign number 4. And this one makes people nervous when I show them photos in my office. Sign number 4, a sudden explosion of skin tags or raised growths. You've probably seen skin tags before. Small, soft, flesh-colored bumps that hang off the skin around the neck, armpits, or groin. Most of the time, they're harmless. But here's what changes everything. When they appear suddenly, when they multiply rapidly, when they show up in unusual places like around the mouth, on the lips, or across the scalp, that is when your body is waving a red flag you cannot afford to ignore. This pattern has a name. Doctors call it lesser Trellat sign. It occurs when an internal tumor, most commonly in the stomach, colon, breast, or lung, secretes growth factors that stimulate the rapid development of seborrheic keratoses and skin tags across the body. In plain language, the cancer is feeding your skin with chemicals that force it to grow uncontrolled bumps on the surface. Think about that for a moment. A 2019 study in the British Journal of Dermatology confirmed that sudden onset of multiple seborrheic keratoses was associated with internal malignancy in a significant number of cases, with gastric cancer being the most common underlying cause. One of my most heartbreaking cases was a 61-year-old woman named Patricia. She had noticed dozens of new raised bumps appearing around her neck and chest over just 3 months. Her family told her it was just aging, just genetics. She waited 8 more months before coming in. By then, her gastric cancer had reached stage 3. We fought hard. We gave her everything medicine had to offer. But those 8 months, they mattered. What should you do? Take a photo of your skin tags every few months. Track them. If you notice sudden new growths appearing in clusters, especially around the neck, armpits, groin, or mouth, see a physician immediately. Mention Lesotrelat sign by name. It will tell your doctor exactly what to look for. Knowledge is not just power. In oncology, knowledge is survival. And that brings us to signs 3 and 2. This is where things get more intense, more urgent. Because these next 2 signs are ones I have seen patients ignore for months, sometimes years, because they looked so ordinary. You are not going to want to skip this part. I want you to look at your hands right now. Go ahead, turn them over.
Look at your palms.
Because sign number 3 may be sitting right there, and you've been calling it something else entirely. Sign number 3, yellowing of the skin or eyes, and the orange tinge you keep blaming on your diet. Most people know jaundice, that yellow color that washes over the skin and whites of the eyes. They know it sounds serious, but here's what they don't know, and this is critical. There is a subtler version, a pale, almost golden warmth to the skin, a slight yellowing of the whites of the eyes that only shows in bright light, something so gentle, so gradual, that patients spend months telling themselves it's a tan, or too many carrots, or just bad lighting in the bathroom mirror. I cannot tell you how many times I have heard that in my office, and I cannot tell you how many times it was pancreatic cancer. Here is the biology. Your liver processes a substance called bilirubin, a yellow pigment released when red blood cells break down. Normally, it flows through bile ducts into the digestive system and leaves the body. But when a tumor grows near the bile ducts, in the pancreas, liver, or gallbladder, it compresses those ducts like a hand squeezing a garden hose. Bilirubin backs up, it floods into the bloodstream, and it deposits itself into your skin and eyes. The color change begins. The American Cancer Society reports that jaundice is present in up to 70% of pancreatic cancer patients at the time of diagnosis. 70%. And yet, the average patient waits 3 to 6 months after noticing yellowing before seeking medical attention. 3 to 6 months. In pancreatic cancer, that gap can be the difference between stage 1 and stage 4. I treated a 58-year-old accountant named Robert. Brilliant man. Meticulous about everything in his life, except this. He noticed his eyes looked slightly yellow in photos for almost 4 months. He told his wife the camera was adding a warm filter. When he finally came in, the tumor had already wrapped around a major blood vessel. We could not operate. Robert passed away 14 months later. I share that, not to frighten you into paralysis, but to light a fire under you. Because the patient I saw that same week, a 52-year-old woman who came in after just 10 days of noticing eye yellowing, we caught her bile duct cancer completely resectable. She had surgery. She celebrated her grandson's birthday last spring. What should you do? Check your eyes in natural daylight, not bathroom lighting. Ask someone you trust to look at the whites of your eyes once a month. If you see any yellow tinge that persists beyond a few days, go in, same day if possible. Tell them you want your bilirubin levels checked immediately. Do not wait for it to get obvious. Obvious is often too late. Now we move to sign number 2. And I have to be honest with you. This is the one that makes my colleagues uncomfortable when I talk about it publicly. Because it is so common, so widespread, that when people hear it is a cancer warning sign, they panic. They think everyone has cancer. That is not what I am saying. But I need you to understand the difference between what is normal and what is a warning. Sign number 2, darkening, thickening skin in the folds of your body. Look at the back of your neck, your armpits, the creases of your elbows, the skin around your knuckles. Is the skin there darker than the rest of your body? Thicker? Does it have a velvety, almost rough texture, like the skin has piled up on itself? This condition is called acanthosis nigricans, and here is where I need you to listen very carefully. Acanthosis nigricans can be associated with insulin resistance and obesity. That is true. Many people have it for those reasons alone. But there is a malignant form, a dangerous form. When acanthosis nigricans appears suddenly in an adult with no history of weight issues or diabetes, especially when it spreads rapidly, covers large areas, or appears on unusual locations like the lips, palms, or soles of the feet, it is one of the most well-documented skin markers of internal malignancy in all of medicine. Gastric cancer, lung cancer, uterine cancer. A 2020 analysis published in the Journal of Internal Medicine found that malignant acanthosis nigricans was associated with gastric adenocarcinoma in over 60% of reported cases where no metabolic cause was identified. Over 60%. The mechanism is chilling. Tumor cells secrete growth factors, particularly something called TGF-alpha, that overstimulate skin cell receptors. The skin and body folds begins to thicken and darken rapidly. Your own skin cells are being hijacked by cancer signals being broadcast through your blood. I treated a 44-year-old fitness instructor named James. No excess weight, no diabetes, perfect blood work for years. He came to me because a patch of dark, velvety skin had appeared on the back of his neck over just 6 weeks and was spreading toward his shoulders. James had never heard of acanthosis nigricans. Neither had his primary care doctor, who had reassured him twice that it was just hyperpigmentation. It was not hyperpigmentation. It was gastric cancer. Stage 2, we caught it. James had surgery, followed by chemotherapy. He is now 3 years cancer-free. But here is what haunts me about James's case. He had visited 2 doctors before me, 2 doctors who looked at that skin and missed it. This is why I am telling you directly, because you may be the only person in the room who knows what to look for. What should you do? If you have dark, velvety patches and body folds, and you have no history of obesity or insulin resistance, take a photograph today. Note the date. If it is growing, spreading, or appearing in new locations over the next 2 to 4 weeks, request an urgent referral. Use the words malignant acanthosis nigricans with your physician. Those words will change the speed of your care. We have covered 4 signs now. 5, 4, 3, 2. And I know what you are thinking. What is number 1? I have saved it for last deliberately, because out of everything I have shared today, this is the sign I have seen missed more than any other. By patients, by nurses, by physicians. It looks so innocent. It feels so harmless. And it has ended lives that did not have to end. I want you to think back to the last time you looked in a mirror. Really looked. Not a quick glance before rushing out the door. Not a check to fix your hair. I mean a real, slow, deliberate look at your face, your neck, your chest, your arms. Did you notice anything that wasn't there 6 months ago? A small dark spot. A tiny raised bump. Something you wrote off as an age spot. A freckle you assumed had always been there. Because sign number 1 is hiding in plain sight, on your skin, right now, possibly being completely ignored. Sign number 1, a changing mole or dark lesion that doesn't look like cancer. I know what you're thinking. Everyone knows about moles. Everyone knows to watch for skin cancer. This isn't shocking. And that right there, that assumption, is exactly why this sign kills more people than it should. Because what most people picture when they hear cancerous mole is something obvious, something ugly, something that looks wrong from across the room. That is not what I am talking about. I am talking about the subtle ones, the ones that look almost normal, the ones that dermatologists in rushed 15-minute appointments dismiss as benign, the ones that patients photograph and post in online forums and are told by well-meaning strangers look totally fine. Let me give you the science, and I need you to stay with me here, because this science will permanently change how you look at your skin. Melanoma, the deadliest form of skin cancer, begins in melanocytes, the cells that give your skin its color. When UV damage, genetic mutation, or immune dysfunction causes these cells to turn malignant, they do not announce themselves loudly. They whisper. They change, slowly, gradually, over months and years, in ways so subtle that the human eye, even a trained one, can miss them without systematic, deliberate evaluation. Oncologists and dermatologists use a framework called the ABCDE rule to evaluate suspicious lesions. And I want to walk you through each letter because understanding this could literally save your life today. A. Asymmetry. Draw an imaginary line through the center of the spot. If both halves do not mirror each other, that is a warning. Normal moles are symmetrical. Melanoma rarely is. B. Border. Are the edges sharp and well defined, or are they ragged, notched, blurred, or uneven? Melanoma borders are irregular. They look like they are spilling outward because they are. Cancer cells are invading surrounding tissue. C. Color. This is where most people go wrong. They look for a mole that is very dark. But melanoma can present in multiple colors within a single lesion. Shades of brown, black, red, white, and even blue. Multiple colors in one spot is a critical warning sign. D. Diameter. Anything larger than 6 millimeters, the size of a pencil eraser, demands evaluation. But here is what most people do not know. Melanoma can be deadly at smaller sizes too. Size alone is not enough. You must evaluate all 5 criteria together. Evolution. This is the most important letter, and the most ignored. Is the spot changing? Is it growing? Darkening? Developing a new color? Starting to itch, bleed, or crust? Evolution, any change over time, is the single most powerful indicator of malignancy. A study published in JAMA Dermatology found that evolution alone, independent of all other ABCDE criteria, was the factor most frequently reported by melanoma patients in the weeks before diagnosis. They noticed something changing, and most of them waited. The average delay between a patient first noticing a changing lesion and seeking medical evaluation is 11 months. 11 months. In melanoma, Stage 1 has a 5-year survival rate of 98%. Stage 4 has a 5-year survival rate of less than 30%. The difference between those two numbers is not treatment. It is not genetics. It is not luck. It is time. Let me tell you about Sarah. Sarah was 38 years old, a mother of 3, a marathon runner, the kind of person you would never expect to get cancer. Fit, healthy, outdoors, constantly. She had a small dark spot on her left shoulder blade for years. She assumed it had always been there. Her husband had glanced at it once and said it looked fine. She wore sunscreen. She was careful. But over about 4 months, the spot began to change. It grew slightly. A small area within it shifted from brown to black. The border on one side became slightly uneven. Sarah noticed, but she told herself she was being paranoid. She had 3 kids, a full-time job, a marathon to train for. She waited 7 more months before coming in. Sarah's melanoma had metastasized to 2 lymph nodes. We treated her aggressively. Immunotherapy, surgery, radiation. Sarah is alive today, 5 years later. She calls my office every year on the anniversary of her diagnosis. Not to report bad news, to remind me, and herself, how close it came. But here is what Sarah told me that I will never forget. She said, I knew something had changed. I just kept waiting for it to look more like what I thought cancer was supposed to look like. That sentence, that one sentence. That is why people die from a cancer that is sitting on the surface of their body, visible, accessible, treatable, and still manage to miss it, because they are waiting for it to look like cancer. Cancer does not always look like cancer. Sometimes it looks like a freckle that got a little darker. Sometimes it looks like a mole you've had for years that just seems slightly bigger. Sometimes it looks like absolutely nothing worth worrying about. What should you do, starting today? Perform a full-body skin check once every single month. Use a hand mirror for hard-to-see areas. Your back, your scalp, behind your ears, the soles of your feet. Take photographs of any spots that concern you and compare them month to month. Use the ABCDE rule every single time. If anything is evolving, do not wait for a routine appointment. Call your dermatologist and use these exact words. I have a lesion that is changing and I need it evaluated urgently. Those words will move you to the front of the line. And if your doctor dismisses you without a proper evaluation, find another doctor. You are your own best advocate. No one will fight for your life harder than you will. Your skin has been talking to you your entire life. Today, and for the first time, you know how to listen. We have covered a lot today, and I know some of what I shared was uncomfortable, maybe even frightening. That was intentional. Not because I want you to live in fear, but because I have watched fear, the right kind of fear, save lives in my examination room more times than I can count. So let me bring you back. Let me give you something to hold on to. Because this video was never really about cancer. It was about power. Your power. Let's go through all 5 signs one final time, because repetition is not just good memory. In medicine, repetition is survival. Sign number 5. Unexplained itching with no rash. That deep, crawling itch that lotion won't fix. That moves around your body with no explanation. That wakes you up at night. If it has lasted more than 2 to 3 weeks and antihistamines haven't touched it, tell your doctor. Demand blood work. Rule out internal causes. Do not accept stress as an answer without evidence. Sign number 4, sudden explosion of skin tags or raised growths, especially when they appear rapidly, in clusters, in unusual places. Use the words laissez-faire sign with your physician. Photograph your skin regularly. Track any new growths that appear suddenly over a matter of weeks. Sign number 3, yellowing of the skin or eyes, even subtle, even gentle, even if it only shows in natural daylight. Check the whites of your eyes monthly in bright light. Have someone you trust look with you. If you see yellow, move fast. Request bilirubin levels immediately. Days matter with bile duct and pancreatic cancers. Sign number 2, dark velvety thickening in skin folds. If you have no history of diabetes or obesity, and this appears suddenly and spreads, it demands urgent investigation. Use the term malignant acanthosis nigricans. Those words will change how quickly you receive care. And sign number 1, the changing mole or dark lesion. Asymmetry, border, color, diameter, evolution. Memorize those 5 words. Perform a full body check every single month. Photograph anything that concerns you. Compare month to month. And if something is changing, do not wait 11 months. Do not wait 11 days. Make the call tomorrow morning. Now here's what I need you to understand. Every single patient I told you about today, David, Maria, Patricia, Robert, James, Sarah, they all had one thing in common before their diagnosis. They thought it wouldn't be them. We all think that. It is the most dangerous thought in medicine, because cancer does not check your age before it arrives. It does not ask if you exercise. It does not care that you eat well, that you have children to raise, that you have a life full of people who need you. It simply grows, quietly, patiently, waiting for you to look the other way. But now, right now, you are no longer looking the other way. You watched this entire video. You took notes, or you should have. You are thinking about your skin differently than you were 20 minutes ago. That shift in awareness? That is not a small thing. That is the difference between catching something early and catching it too late. I have been doing this for over 2 decades, and the patients who survive, the ones who beat the odds, who call my office on their anniversaries, who send me photographs of their grandchildren, they are not always the ones with the best genetics or the most advanced treatment options. They are the ones who paid attention. They are the ones who took that uncomfortable feeling seriously. They are the ones who made the appointment when everyone around them said they were overreacting. You are now one of those people. So here is your action plan. Starting today. Step 1. Do a full body skin check tonight. Use a hand mirror. Check your back, your scalp, behind your ears, between your toes, the soles of your feet. Photograph anything that seems even slightly unusual. Step 2. Schedule a professional skin check with a dermatologist if you have not had one in the past 12 months. Not next year. This month? Step 3. Share this video with someone you love. A parent. A sibling. A friend who never goes to the doctor. You may not know whose life you are saving, but you may be saving one. Step 4. Bookmark the ABCDE rule. Write it on a sticky note. Put it on your bathroom mirror. Make it part of your monthly routine the same way you check your blood pressure or step on a scale. Step 5. Trust yourself. If something feels wrong, if a spot looks different, if an itch won't quit, if a patch of skin changes color overnight, do not talk yourself out of it. Go in. Be that patient who is told everything is fine. That is the best possible outcome. But never, never let fear of being wrong stop you from finding out the truth.